Today, we're talking about Mannitol. It's a seriously powerful tool that doctors use in some of the most critical situations you can imagine. We're talking traumatic brain injuries, emergency eye surgery, you name it. So, what is this stuff, and how on earth does it work? Let's get into it.
And this right here is the central mystery, isn't it? At its heart, mannitol is basically a type of sugar alcohol. So how can something so simple pull off a task as mind-blowingly complex as saving a swollen brain? Well, the answer isn't some medical magic. It's actually just a fundamental principle of physics.
So let's break down what mannitol actually is. It's a naturally occurring sugar alcohol, which is interesting, but the most important part of this definition, the real key, is that it's pharmacologically inert. That's a fancy way of saying the body doesn't really do anything with it chemically. It just passes through. And that very fact, its total inertness, is what makes it a powerhouse. Its magic isn't chemical, it's physical.
To really get mannitol, we have to unlock the secret of how it works. And that secret has a name you probably remember hearing way back in high school biology class: osmosis.
Yep, the entire powerful, life-saving effect of this drug boils down to this one simple concept. See, nature is all about balance. So when you inject mannitol, you suddenly make the blood super concentrated, and water from all the less concentrated areas around it will literally rush across membranes to try and even things out. Here's the best way to picture it. Imagine the mannitol molecules flowing through your blood vessels are like thousands of tiny, super thirsty sponges. All that excess water in the surrounding tissues, like, say, a swollen brain, is just naturally drawn to these sponges and gets pulled right into the bloodstream. It's a purely physical pull, all thanks to that drive to balance things out.
But this whole process isn't just a one-and-done deal. Mannitol's action is more like a two-part story, a 1-2 punch that involves both the bloodstream and then the kidneys. Let's see how it all unfolds.
So here are the two phases, side by side. Phase 1 happens right away, in the bloodstream. Mannitol immediately expands the blood volume by pulling in all that extra fluid. Then, in phase 2, the kidneys get in on the action, working to get all that excess water out of the body through something called osmotic diuresis, which is really just a powerful forced urination. Let's dig into that first phase a little more. Okay, so phase 1. The moment mannitol hits the bloodstream, it starts pulling in water, which instantly increases the total volume of your blood. And this has a pretty fascinating side effect. It actually makes your blood thinner or less viscous. Thinner blood flows way more easily, which means better blood flow and, critically, better oxygen delivery to the brain. Your body then senses this and can respond with a reflex that actually constricts some blood vessels in the brain, which helps reduce the pressure even more. And now for phase 2. Your kidneys start filtering the mannitol out of the blood. But here's the genius part. They can't reabsorb it. So as the mannitol travels through all the tiny tubes in your kidneys, it keeps acting like that thirsty sponge, holding on tight to a massive amount of water and pulling it right out of the body as urine. This creates an incredibly powerful flushing effect. Okay, so we've got the principle of osmosis down, we've got the two-phase mechanism. Now let's see how all this science actually translates into saving lives in the real world.
This is, without a doubt, Mannitol's #1 mission. After a serious head injury, a stroke, or with a brain tumor, the brain can swell up. But here's the problem. Your skull is a solid, rigid box. There is zero room for that swelling to go. So the pressure inside, the intracranial pressure, or ICP, just skyrockets. And that can be absolutely fatal. And here is the play-by-play of how mannitol fights back. First, that infusion makes the blood super concentrated. Then, that powerful osmotic gradient goes to work, pulling excess water directly out of the swollen brain tissue and into the blood vessels. And the result? The brain's volume literally shrinks, providing immediate life-saving relief from that crushing pressure. And the exact same principle works on the eye. In situations like an acute glaucoma attack, the pressure inside the eyeball, that's the intraocular pressure, can shoot up to dangerous levels, threatening your optic nerve and your sight. Mannitol comes in, pulls fluid from the eye into the bloodstream, and rapidly brings that pressure back down. But mannitol is actually a pretty versatile player. It's also used to help flush out the kidneys to prevent injury during really big surgeries, or to force the body to get rid of certain poisons. And, get this, it's even used as a special fluid in some urological procedures, because unlike saline, it doesn't conduct electricity. Pretty neat. But listen, a tool this powerful doesn't come without risks. Using mannitol is never a simple fix. It's a high-stakes, delicate balancing act that requires the medical team to be constantly on their toes. And this is the number they are watching, like a hawk. Doctors are constantly checking the concentration of the patient's blood, its osmolality. As a general rule, they try to keep it from going above 320 milliosmoles per liter. Why? Because if you push it too high, you risk damaging the very kidneys you're relying on to get the mannitol out of the body in the first place. Yeah, this power has a flip side. Doctors have to watch out for things like severe dehydration. But there are also what we call contraindications. These are situations where you absolutely cannot use mannitol. For instance, if a patient has severe heart failure, that initial rush of fluid into the bloodstream could completely overwhelm their heart. Or if a patient's kidneys have already shut down, well, there's just no way to get the drug and all that extra fluid out of the body. So let's wrap this all up. The best way to think about mannitol isn't just as a drug, but as a powerful precision tool that harnesses a fundamental law of physics. But it's a tool that demands respect and vigilance.
So what are the big takeaways here? First, mannitol is just a simple, inert sugar that gets all its power from pure physics. Second, it works entirely by creating an osmotic gradient to pull water where it's needed. Third, its main job is to reduce life-threatening pressure in the brain and eyes. And finally, using it is a massive balancing act that requires constant, intense monitoring.
And you know, this quote just nails it. Using mannitol is the very definition of a balancing act. It requires doctors to have a crystal clear understanding of how it works, to be incredibly vigilant in monitoring their patient, and to constantly weigh the risks against the incredible, life-saving benefits.
Which kind of leaves us with one last thought. Mannitol is just a simple sugar, yet it can manipulate the body's fluid balance with life or death consequences. It really makes you wonder, right? What other seemingly simple things are out there, holding all this complex medical power, just waiting for us to figure them out?